This is Justine Calderwood, physical therapist here at the Healing Spot Physical Therapy, and today I want to show you a technique that you can use to relieve low back pain or back pain, your whole spine, and also it's called a Dural tube release. And I'm going to talk a little bit about frankincense essential oil along with this. So I'm going to show you the technique, I'm going to walk you through it, and we're going to do it together. So let's get started. Let's first talk about what the Dural tube is. So basically it's the deepest lining of the spinal cord. So it's a deeper spinal tissue. It lines the spinal cord. So I have my spine here, and you can see just the pelvis in the front, and then the spine as it stacks on, and you have your head up on the top, which I don't have the full head right here. But basically the Dural tube covers the spinal cord, okay? So as it goes down through the spinal column, all of the peripheral nerves, so those are the nerves like the nerves that go down into your leg. The sciatic nerve is one of the biggest nerves that people know and they're familiar with. And then also the nerves that wrap around your trunk and the nerves that come from your neck down into your arms, okay? So all of that spinal tissue, as well as your brain, the inside of your head. So think about the inside of your skull, between your brain and your skull bones. All of the skull bones are surrounded by Dural tube, and also down into the jaw. So you can imagine this covers, well, pretty much your whole body, okay? So I want to show you how to release the Dural tube, so that way you can start to get some relief into your back, and you may even notice it down into your extremities, into your arms, your legs, okay? So I want to talk a little bit about frankincense as well. And the reason that I'm covering this is because this is one of the techniques that I'm going to be covering in my Release Your Root workshop that's coming up. It's a 4-week workshop. You get 4 hours total of guided techniques like this, and the background information about self-healing and how we can use our own hands, how we can use a small little inflatable ball to bring balance back to our body and start to feel better and move easier, okay? We also cover essential oils. I use Young Living because of the seed to seal guarantee, because of the quality. They have their own farms, and they truly are therapeutic grade essential oils, not what you find in the grocery store that are oftentimes adulterated and diluted with carrier oil. So I love frankincense. It's one of the things that you'll get if you decide that you want to try out the workshop. I'll send you a sample of this, as well as a small inflatable ball. So why do I like frankincense, and why did I choose it for this class, and why I'm going to use it today? Because it really does a great job of helping the nervous system calm down a little bit, okay? So how do we apply essential oils? I'm going to go over one technique. So I like to apply it topically. So I'm just going to take a drop or two and place it in my hand here, okay? And then I'm going to just swirl it around. And places I like to put it are just along the base of my neck, down into the spine. I like to put it along my spine as well, okay? Up over my heart, and then up like over my forehead, okay? Because a lot of times when I'm trying to calm down my nervous system, my mind's just going, you know, kind of racing, and so I just want to check in and kind of ground myself. The thing with frankincense, Young Living specifically, is that it's been measured around 147 megahertz. When we use essential oils that have lower frequency, they help to balance physical areas of the body, where this is more for like spiritual connection and mental emotional help, okay? So with that, we're going to get started. All you need for this is a wall, or like some free space on a wall, or even a door, okay? So what you're going to do is you're just going to bring yourself to the wall, and I suggest starting where you're sitting, kind of facing the, or not facing the wall, but you're beside the wall. And what you're going to do is just lie down onto your side, and you're going to bring your legs up onto the wall, okay? So keep in mind here, hopefully you can see me okay. Keep in mind that if you have a lot of tightness into your hamstrings and the back of your legs, you might need to scoot out away from the wall just a little bit and allow your knees, you want your knees to be straight, but you may need to allow a little bit of space between your butt and the wall, okay? So I have plenty of flexibility here, so I want to be up against the wall as close as I can. Feet on the wall, and you can take your hands here and just put them out about shoulder height, okay? So this is where we're going to start, and we're going to hold this for about 3 to 5 minutes, okay? So I'm going to walk you through this basically with your legs on the wall, knees as straight as you can go without forcing them, okay? Palms up. I want you to just start to soften into your body. So what I mean by that is, although I'm talking, I want you to just start to breathe and feel what's going on in your own body. Feel the floor underneath you. Feel your legs resting on the wall. And just start to feel your body like you're folded in half, like you are. So from here, if you think about your hips right now being the center of your body, I want you to just start to intentionalize, like just kind of draw those feet up towards the ceiling just a little bit, and then out through the top of your head. So it's like you're trying to grow taller through your feet, out through your head, and then from the center of your chest, out through your arms. So when we release a dural tube like this, and we put a little bit of a stretch on it, like we are, it takes up to 2 minutes to start to release the soft connective tissue called fascia. If you want a little bit of extra release here, I'm going to guide you through. I'm going to have you take your hands. Now, you can stay in this position if you'd like. But if you want to start to feel this release with your own hands, which is super powerful, by the way, I want you to just take one hand, put it up underneath your head. Okay? The other hand I want you to take, and I want you to just rest it on your forehead. So now you're kind of creating a sandwich between your hands. So without pressing down and pushing on your head, I want you to just bring your hands a little closer together. Allow your top hand to sink down. Allow your bottom hand to kind of sink up. And just feel what's going on between your hands. Don't force anything. Just see how far your body is allowing your hands to come in. And now from here, I want you to imagine that you're kind of holding a helmet on your head. And I want you to draw that helmet so your top hand comes down towards your nose, and the bottom hand, you're just doing a slight lift up towards the top of your head, almost like you're trying to lift that helmet up off your head or down towards your nose. And from there, I want you to start to expand your awareness of what you're feeling in your body. What that means is don't just feel your head. Start to feel down into your neck, down into your upper back, your chest, even your throat. How far down can you feel a little bit of tug as you take up the slack? It's almost like you're pulling on an elastic band. You don't want to force that band to open up or stretch. You're just taking up the slack and holding there. And when you get to a stopping point, you're just going to pause, wait for your body to soften, and see what it needs to do. Does it need to release a little bit more? Do your hands, are they guided in any particular direction? So continue to feel your whole body down into your pelvic area, your lower back, your abdomen, into your legs. You may notice heat, like a warmth, a flushed feeling. You might notice a release. You might get some pain or discomfort. You may not feel much of anything, and that's okay too. Whatever you're feeling, just bring your awareness and your breath into that area. See what that area is trying to reveal to you. What needs to release today? as your body softens and allows a little more movement, take up the slack. Keep taking up the slack without forcing. This should feel really easy to do. Notice any movement, any position that your body is drawing your hands into. Your hands might glide left or right. You do not want to be gliding or sliding on the surface of your skin. We are not doing massage. Okay. Just because I want to keep this video somewhat short, I'm going to go ahead and stop. But I want you to continue with this, continue to hold. You cannot over-release the fascia. So if you're not forcing things, you're waiting for your body to let go, and you're just simply following and taking up the slack, you're not going to hurt yourself. When you're done, just very gently let go. You don't want to just take your hands off, and that can cause some rebounding into your body, okay? So that's the dural tube release, and yeah, so it's just one of the releases that we do actually week 2 during this spine and the low back releases. So I would love to guide you through this. I do offer a replay with the course, so it's going to be going on Tuesday starting June 9th through the month of June. 4 weeks, 1 hour each. If you can't make it live, please sign up. I've had people do this and watch the replays, and they're getting a lot out of it. I'm hearing a lot of good responses, from decreased pain to I don't have to go to the bathroom near as much as I used to you're just really, it's really relaxing and soothing. So thank you very much. Let me know if you have any questions, and thanks for watching.